For lab this week, we are going to be reviewing the hand and the wrist module. So the first thing I'm going to do when Cole walks into the athletic training room is note if there's any excessive swelling in the wrist or down the metacarpals into the phalanges. I could also note if there's any discoloration or if there's poor circulation within the nail bed as I push down. So we want to make sure that we get an appropriate amount of capillary refill. Once that looks okay, I'm going to move into palpations. So first I'm going to start on his palm. On the radial side of the wrist here, we have the thenar eminence, palpating here. On the ulnar side of the wrist, we have the hypothenar eminence. Remember, hypo means smaller. And then right in between here, we have the thenar eminence. From here, I'm going to just go right into the carpal bones. So remember, when we're starting on the most proximal row, we start at the radial side of the wrist, beginning with this scaphoid. So you can palpate basically right at the base here, or you could also have the patient make a thumbs up. So thumbs up here, good. And then tilt your hand down, and then I'm just palpating right in the anatomical snuff box. Anytime that a patient comes in with a Fuchs mechanism, or if I'm concerned about any type of wrist pathology, I always want to make sure that I palpate the scaphoid to make sure that there isn't any long-term damage, just because there's really poor blood supply and the bone could actually decay on its own if it's not, if we don't take a look at it right away. So we started with the scaphoid. Next we go into lunate as we go towards the ulnar side of the wrist. We have the triquetrum. Pisiform is going to be all the way at the ulnar side. Remember, we start all the way back on the radial side of the wrist to trapezium by the thumb, trapezoid, capitate, and then hook of the hamate, again ending on the ulnar side of the wrist here. On the dorsal side of the wrist, we have the ulnar styloid process. On the contralateral side, we have the radial styloid process. If we move just dorsum to that is the Lister's tubercle. So Lister's tubercle can be found on the radial side of the wrist here. From here, I can go into his metacarpal, so I'm just going up the metacarpal shafts here, and then down into the phalanges. So I like to give a little bit of pressure with these just to make sure that I'm ruling out any potential fracture if you were to slam his fingers against a basketball or soccer ball or anything like that. All right, so now we have active range of motion. So with the wrist, we have flexion, extension, ulnar deviation, and radial deviation. So just like the elbow, I'm going to have Cole stand to the side here. I'm going to put the stationary arm just parallel with the ulna. The fulcrum is going to be right at the wrist joint, and then the moving arm is going to follow digit 5, and I'm going to ask Cole to bring his fingers down towards the ground. So this is for wrist flexion, good. And then bring him back up to neutral, and then I'm going to ask him to bring his fingers up towards the sky, good. And that is for wrist extension. For wrist ulnar deviation, I'm going to put the fulcrum directly on top of his wrist. The stationary arm is going to go right in between the interosseous membrane between the radius and the ulna, and then the moving arm is just going to follow the third digit. So for ulnar deviation, I'm going to ask him to bring his fingers out towards the ulnar side of the wrist. Good, and then just measuring that angle there. Back to neutral here. And then I'm going to ask him to radially deviate or bring his thumb towards the inside of his wrist. Good. Go ahead and relax. So that's what you would assess for wrist flexion and extension. You could also measure metacarpal phalangeal flexion and extension. However, the goniometer is a little bit too big to actually assess that within this video, so I won't demonstrate that, but there are small enough goniometers where you can measure that, as well as the interphalangeal joints. For passive range of motion, I'm just going to bring Cole back up in this position here. He's going to totally relax, bringing him down into wrist flexion, wrist extension, wrist ulnar deviation, wrist radial deviation. I could flex his fingers, so this is the metacarpal joints. Extend them up. You could also do flexion and extension of the interphalangeal joints here, as well as AB and adduction. For resisted range of motion, you would just bring the patient all the way into maximal range of motion. So here he would be in maximal flexion, and then I want him to extend his wrist up. Good, so that's resisted extension, resisted flexion, push down. Good. Next, going into resisted ulnar deviation, I'm going to maximally radially deviate him, ask him to bring his hand out all the way. Good. Bring his hand in for resisted radial deviation. Good. You could also resist interphalangeal flexion, so he's completely extended. I'll ask him to curl his fingers down while I resist him. Good. He can extend up against my fingers. He can push out against my fingers, so that's going to be resisted abduction, so push out. Good. If he's pushing in, that's going to be resisted adduction. At the thumb joint, it does AB, adduction, opposition, flexion, and extension. So I can do that first with just passive, going through all of these motions, and then I can have him do resisted range of motion. So I want you to bring your thumb across your palm. Good, and extend up. So this would be for flexion. He's going to bring his thumb back towards digit 2, so that's going to be resisted adduction for the thumb. Pulling away is going to be resisted abduction. And then I'm going to ask him to flex his finger all the way, and I want you to extend your thumb up, so this is resisted thumb extension. For the PowerPoint presentation, I know in some of the previous versions of it, it'll say manual muscle testing. Technically, the manual muscle testing for the wrist and the fingers are simply just referring to resisted range of motion. Next, we have the wrist special test. So I'm going to ask Cole to step over here. Yep, just like that. So for the varus and the valgus stress tests, can you see us? Can you pause it? Just pause it. It's fine.
I was